Okay, so I think I will wrap up the first topic that we studied about cells first. We basically wrapped up everything, but I recall telling you all that I will teach you the directional terms used in medicine. And these are the terms. So it's pretty simple, but you need to get used to the names. So let me choose my pointer. Okay, you see this, there's three different layers here, three different planes. So planes is like that shade that tells us how the body is divided. So this one, the green colored one, this plane, this is what you called the coronal plane. I would also put like extra notes at the bottom for you all to study once I upload the slides. So the coronal plane is also called the frontal plane because this is the one that divides the body to the frontal part and the back part. And the front part is what we call the anterior part, and the back part is what we call the posterior part. And then let's look at the yellow plane, this the one that basically divides the body into two, the top and the bottom. So in this case, the superior, so we divide it into superior and inferior. The superior is the one heading towards the head. So towards the head part is the superior, and then towards the feet part is the inferior. And the layer that divides the superior and inferior, that plane is called the transverse plane, or also known as the horizontal plane. So horizontal because it's horizontal like that. Okay, and then the last one is this one, the pink colored one. So the pink colored one goes like this. It basically divides your body into the half like this, into left side and the right side. So if you look at the picture, you will see the left side is called the lateral part, and the right side. So look at the hands of the person and choose based on that. So the right side is the lateral side and the left side is the medial side. So that was the simple part. It's fairly simple, but you just need to like know the names and get familiar with it and the directions, of course. So that was it for directional terms used in medicine. For today, our main topic is actually the respiratory system, and we will start now. Let me just take the attendance real quick. Okay, we have Sue, and Jake, Kimpar, and Elizabeth. Okay, let me just mark the attendance. Okay, good. Let's go to the next topic. Oh, someone has joined. Let me take it. John. John is here. Okay. So we will go into our main topic for today. But before that, does anyone have any questions from the previous lecture about cells, tissue, organs, and system? I'll take that as a no. Let's start with today's lesson, the respiratory system. And this is the human respiratory system we're talking about. Okay, the human respiratory system. It is the very first system we're studying because it involves gaseous exchange. We inhale oxygen and we exhale carbon dioxide. We breathe, and that's how we stay alive, right? Without breathing, it would be impossible to stay alive. So let's look specifically at the human respiratory system because this is in your syllabus and you will be tested on this. So I want you all to imagine this. Imagine that your oxygen molecule, because we need oxygen to go into our body so that our cells can get that oxygen, right? So the cell survives. So imagine if you are like a tiny oxygen molecule, how would you enter the body, and where do you need to go, and what happens to you once you enter the body? How do you go to the cell? This whole journey. So now I want you to imagine that you are that molecule taking this journey, okay? So you all are the oxygen molecules. Let's go in. And your the destination that you all are going to is called alveoli, okay? We will see what that looks like and what it is later, but know that you're an oxygen molecule that has to enter the body, the human body, and you need to find your way to the alveolus or alveoli. Okay, let's go. So by the end of this lesson, you should be able to describe the function of the respiratory system. You should be able to label the components of the respiratory system. You should be able to describe the structure of the lungs, like how do the lungs look like, from inside included. And you should be able to outline the respiration process and also describe how asthma, I'm not sure if you've heard of asthma before, but it's one of the conditions, some people have breathing conditions. So you should be able to describe how that is managed. Okay, let's dive in. So you are the oxygen molecule, just remember that. Let me minimize this. Okay, so the respiratory system, it consists of different organs and tissues involved in the process. We studied the tissues in our previous sessions. We also studied what organs are, and specifically, we're looking at the lungs in this one, okay? So the respiratory system, let me pick my pointer again. The set of organs that and tissues that are involved, right? They uptake oxygen from the atmosphere, from outside the body in the atmosphere. They take that oxygen. In this case, I want you to pretend that you're the oxygen. So the oxygen will be taken in from the atmosphere, and the carbon dioxide from the body, the waste gases, will be released out during this respiration process. This gas exchange of taking the oxygen in and carbon dioxide out, it is called breathing or external respiration. So when you breathe in, you take in oxygen. When you breathe out, you exhale carbon dioxide. And this gas exchange, this is called gas exchange because you're exchanging. You take in oxygen, you give out carbon dioxide. Okay. Before we dive in, so you're the oxygen molecule. You will start here at the nostril. This is the nostril. Once you take the oxygen goes down through the larynx, then it will go through the trachea. Trachea is like the windpipe. Then you see here bronchus dividing the windpipe divides. That's the bronchus. And you will see the bronchioles, the small branches. But your ultimate destination, again, remember, is the alveoli. So we're going to get there. Let's look at the steps one more time. The steps involved in this gas exchange of taking oxygen in starts from the nose or the mouth. Humans, we breathe through both, right? We breathe through the nose and we can also breathe through the mouth because sometimes it's necessary to breathe through the mouth. For example, when you run and you're so exhausted and you need that oxygen, you start to breathe in through the mouth. So both nose and mouth, they both can take in the gases, oxygen, right? And then after the nose or mouth, the next destination is the pharynx. After the pharynx, the next destination is the larynx, and then after that is the trachea. Trachea is also known as the windpipe. So we will look into deeper parts of this again later, but just remember these: nose or mouth, pharynx, larynx, trachea. Then from the trachea, you see this, this bronchi. And then you see these bronchi are divided, right? And then you see bronchioles, the smaller branches. But the alveoli is where, again, you're the oxygen reaching your destination. It's the alveoli you need to go to, which are at the tip of these bronchioles. We will have a look at that later again. So once the oxygen goes into the alveoli, right, this destination, the oxygen then diffuses to the bloodstream. Because how does your body actually get that oxygen? It's through blood, because blood circulates everywhere. Your blood goes from your, like, it has to go to the head all the way to the feet, your toes. So that's why oxygen is carried by your blood so that it can reach every part of your body. So the oxygen will go to your blood, and the carbon dioxide will come out from your bloodstream. So alveoli is where that exchange is happening. The oxygen goes into the blood, and the blood that has already used up the oxygen and collected all those waste materials, including carbon dioxide, it will come out. Oxygen goes in, carbon dioxide come out, and then the diaphragm, it relaxes. So when the carbon dioxide comes out into your alveoli, your diaphragm relaxes and it pushes the air out of the lungs so that the carbon dioxide can come out. And then again, the process is done the same. Like the carbon dioxide also has to take the same route. So it goes up the windpipe into the larynx, pharynx, and then comes out through the nose or mouth. So let's have a look at this one more time. The larynx. This is the trachea. This is the bronchus. So one is called bronchus, two is called bronchi. And then the smaller branches are bronchioles. So one more time, larynx, trachea or the windpipe, the bronchus, and the smaller branches, bronchioles. And after this, it goes to the alveoli. So let's look at the organs that are involved. In the previous lesson, we learned that organs are made of different tissues that come together. So let's have a look at that. The organs involved are the nose and the nasal cavity. So the nasal cavity is this part. The nose is, of course, the main entrance for even humans. We don't go around breathing through our mouths all the time. Sometimes we do, but it is the nose. The nose is the main organ for breathing in and exhaling, inhaling and exhaling, right? So the nose is that primary entry point. Then inside the nose, we find the nasal cavity, which you can see here. And the function here is that it filters the air. So inside your nose, you notice there's hair. There's also mucus. So as much as you might dislike nose hair and mucus, it's actually there to help you. So it will trap all the dirt that's going in. It will be trapped by the little tiny hair in your nose and also by the mucus, the green stuff in your nose. Or it can be different colors. But yes. And then it also ensures that the air going in is not too cold. It tries to warm up that air a bit. The humidity is also controlled. So before it reaches your lungs, it has already been somehow balanced and cleaned in the nose. Okay. So your nose has at least two functions here you see. One is that it's used for smell, but the other one is that it helps you breathe and it filters the air that you take in. Okay, the mouth. So this is the mouth and the oral cavity. Oral means related to the mouth. So you see like oral wash, oral, in dentistry, you will hear the word oral a lot. So it's all related to the mouth. So the mouth is then the second option is the mouth. This is especially if it's necessary for you to breathe through the mouth when you're struggling to breathe through the nose. But remember that the mouth's main function is food, like it tastes the food and helps you swallow the food and to speak. This is just like a bonus, the bonus function that it performs for us, the inhaling and exhaling. So, okay, the nasal, nose, oral, mouth. Okay, remember these two. Nasal is related to the nose, oral means related to the mouth. So the nasal passages, if these places, if there's any blockage here, whether it be when you choke on food or when you're drinking water, you choke on water, or when you're in the pool and the water is going in, but you can't breathe then, right? So whenever there's a blockage, then it can be very, as humans, we can die quite fast if our respiratory system is interrupted, if our breathing is interrupted. So sometimes when your nose is blocked, like for some reason, if there's something stuck or there's a blockage or it's not easy for you to breathe through the nose, maybe sometimes you're in the water, when you come up, the first thing you do is breathe through your mouth. So that's also necessary for your survival. Let's go to the pharynx. So the pharynx is, it comes before the larynx. And the pharynx is that point that connects the nose part, the nasal cavity, and the mouth to the trachea. Okay, and this is the common pathway. So this is where sometimes when you see children, they choke on food. It's because of this part. Like the nose and the mouth, there is a point where they're connected. And if somehow the food enters into the wrong part, the nasal part, the child will choke. That's why you have to perform a few tasks. Like there are a few tasks that you could perform to save a child from choking. But the reason they choke is because the nose and the mouth, that area is connected. So it's possible, it's very possible for the food to get stuck in the wrong place and block the air from going in. And the pharynx is, it directs the way to the larynx. Now let's look at the larynx. The larynx is here. So the pharynx is out here, and this is the larynx. And if you see, larynx is very important because it's like a gate to the windpipe. Okay, so the larynx is the gate to the windpipe. Remember, it's also known as the voice box. So the larynx connects the pharynx to the trachea, and it allows air to pass through. But more importantly, it prevents the food and drinks from going to the trachea, to the windpipe. So it ensures that the air goes in, but nothing else. And next is the trachea, the windpipe. Just to confirm, you all can see my cursor, right? The laser that I'm using. And can you see the laser pointer that I'm using? Okay, Kimpar, thank you for responding. Yes, okay. So the trachea is the windpipe. So oxygen, carbon dioxide, and a little bit of other gases pass through here. They go in through here, they come out through here. This is their passage. And again, over here, this whole process happening over here also ensures that the air you're breathing in, that it has warmed up a little bit, that the temperature is good, and that the humidity is also controlled so that the gas exchange is efficient. Okay, next is the bronchi. So bronchi, these are the bronchi. The yellow one is just zooming in, okay? The bronchi are here, the bronchi. So bronchi and bronchus are the same thing, but bronchi is plural. If two, it's called bronchi. If one, just this one, is called bronchus. Okay, so the bronchi are the main airways to the lungs. These are your lungs. The bronchi are the main parts that enter your lungs. So the trachea, it divides into two here. And you see a bronchus into each lung. We have two bronchi here in this image, and each lung has this bronchus. Same thing again, just that one is singular, and bronchi is plural. The bronchi also has tiny hair-like structures, and these structures, so it's not like hair. It just looks like hair-like structures, but its name is actually cilia. You can search it up on Google and you should be able to see the picture. And the cilia helps in moving the mucus out of your lungs, especially when you're sick, when you have a sore throat and flu and your chest feel congested, the mucus will be a lot at that time. It's the cilia that's helping push out the mucus from the lungs to clean the lungs and keep it healthy. Next, the bronchioles. So bronchioles zoomed in here again, but it's this, but this yellow part here represents the zoomed in structure. These are the bronchioles. Bronchioles are like baby bronchi. So there's lots and lots and lots of them. The bronchi are the passages that actually take the oxygen to the alveoli. Alveoli is our main destination where we will have a look soon. But the bronchi are responsible, these smaller pathways are responsible for ensuring that the oxygen reaches the alveoli. Okay. Let's look at alveoli. Okay, alveoli is, let me zoom in again. Yeah, so if you zoom in, you see at the end of these bronchioles, you see these small sacs. Okay, these sacs are actually the alveoli. And the alveoli is that site where gaseous exchange occurs, where oxygen enters the bloodstream and carbon dioxide leaves the bloodstream. So in alveolus, again, alveoli and alveolus is the same thing, but when it's one, we call it alveolus. If it's many, we call it alveoli. So again, singular is alveolus, plural is alveoli. So in the alveolus, oxygen molecules will move from the alveoli to the bloodstream. And at the same time, the carbon dioxide will come out of the bloodstream into the alveoli so that it can be taken out of the body. So let's have a deeper look at that. This one is for you to read. Oxygen-rich air enters the alveoli during inhalation, and then the oxygen molecule diffuse into the alveolar walls, into the bloodstream, and in the bloodstream, it specifically binds to hemoglobin in the red blood cell. At the same time, carbon dioxide diffuses from the blood into the alveoli so that it can be taken out of the body. And again, it's harder to understand if there's no diagram, so I did put a diagram for you all. Let's have a look at the diagram. Okay, you see, so I want you to continue imagining that you're the oxygen molecule. So you're the oxygen outside in the atmosphere, and you went in through the nose and the pharynx, larynx. This is your final destination, okay? This is, so just quick one. I want you to imagine this again, this. Okay, so you're the oxygen molecule. You went in, pharynx done, larynx. This is the trachea, the bronchi, the bronchioles. And now you're at your destination. So let's go back to the alveoli. Okay, so now you're here. You're here at the ends here. And if we have a deeper look on what's happening inside there, so you're the oxygen molecule that came into that alveolus, that small sac. And here, you see these red ones, these are the red blood cell. The white one is the oxygen. So as an oxygen, you came in, you attach to the red blood cell. And in the red blood cell specifically, you attach to hemoglobin in the red blood cell, okay? And then the body is now using you. So you attach and you go to the body. And then from here, you go travel throughout the body where you're needed. And at the same time, the blood is, hold up. Okay, at the same time, the blood is coming from the rest of the body here. And as it's coming back, it has carbon dioxide attached to this. And the body doesn't need that carbon dioxide. The body, if anything, the body needs to remove that carbon dioxide, okay? So the carbon dioxide, let me take my pointer again. So again, you are the oxygen that came in and you were taken to the rest of the body. And then from the rest of the body, the oxygen was already used and now these are the waste products. So carbon dioxide. We don't want the carbon dioxide, so it diffuses out. The carbon dioxide diffuses out into the alveoli or the alveolus, since this is one, and then goes up and it's to the lungs and then all the way up so that it can be excreted, exhaled. Okay, so here, up, and then it will take the same pathway up to your nose and mouth to be taken out. But the oxygen goes all the way in, goes to the bloodstream, attaches to the hemoglobin in the red blood cell, is taken to the rest of the body. And then the one that has brought the carbon dioxide that needs to be removed from the body comes out to the alveolus and is breathed out. So breathed in oxygen goes in, breathed out carbon dioxide goes out. Inhaled, and this is exhaled. Is it clear? This diagram is very important. So let me know if you need further explanation on this. So far, so good. Thanks, and thanks, Jack. Okay, Kempar and Sue, I hope you're keeping up with the lesson so far. Okay, thank you. So we shall proceed with the next slide. Okay, I think before we proceed, I will give you a 3 minutes break because we've been studying quite intensively. You can have a 3 minutes break, and I will see you at 6:30. Yeah, so you can go for your bio break, drink water, or just digest whatever I've shared with you, and we'll resume again in 3 minutes time. In the meantime, I will just go back to the slides. I'll keep going back and forth so you can read. Let's go to start. If you're taking notes, this is also your time to write back anything that you may have missed. Elizabeth, sure, I can explain to you again. Which part specifically do you want me to explain? Just let me know. I'm moving the slide and you can tell me when to stop. Oh, okay, I think you want the overview. Okay, I will explain to you the overview. Okay, so for those of you who want like a brief summary of that whole process again as an oxygen molecule where you travel, let's go through it again. Okay, let's see here. I think this will give us a quick summary. Okay, so when you breathe in oxygen, right, it goes in through your nostril. Let me laser pointer. Or should I use a pencil? Okay, I can't use it. Okay, so you breathe in the oxygen. It goes in through your nostril into this nasal cavity. This is the mouth, right? So oxygen is coming from both sides, from the nose and from the mouth. The nasal cavity is here. The oral part is here. Then over here, there's a part called pharynx. Pharynx is basically where the nose and the mouth area meet. Okay, and then after that, the oxygen goes through the larynx. And the larynx is very important because this is where the food is, like the food can't go in and other molecules can't go in. It's just gases, okay? No food, no water, nothing. So the larynx is like that gate that prevents food and water from entering, but it only allows the air to go in. And then after the larynx, so the larynx, the oxygen goes in into the windpipe, also known as trachea. So trachea and windpipe are the same, but know both names, okay? You need to know these names. So the trachea, this is basically the passage, the pathway for the oxygen to go in, or any gas to go in or to come out, okay? The trachea, but it's only for gas. It's not for food or water, nothing else must go in. The gas goes in through the trachea. okay, going in through the trachea. And then over here, you see it divides. It divides, and these branches of the trachea, we call them bronchus. So like how there's a tree, right? A tree has the bark, and then it has branches. So the same way trachea, these bigger branches that divide into two, we call them bronchi. So together we call them bronchi, but one we call bronchus. So bronchus, two bronchi. So the trachea divides into bronchi. Okay, bronchus is one. And then it divides even further. You see all these small branches, then these are what we call bronchioles. So bronchi, it basically directs the air to both the lungs, share the load. So some air goes to the left lung, some air goes to the right lung. Okay, and then further in, it goes into these bronchioles, smaller branches. And the bronchioles, there are many bronchioles because bronchioles are attached to what we saw just now, the alveolus, and there are millions of alveolus in your body. So let me enable editing. Uh, Let me draw out the bronchioles. Okay, so over here at the end here, you have bronchioles. There's many bronchioles. There are millions of it's more than 300 million of bronchioles in your lungs. And then again, these bronchioles, they're, okay, these, let's see. Let me summarize it all in one picture for you so it's easier. Okay, forgive the writing. Okay, this one is alveoli. Alveolus. Plus because I'm pointing at one. If I point at many, then it's alveoli. Okay, and here is the, sorry, I didn't mention is pharynx. Pharynx. So alveoli, bronchioles are these branches. These branches are bronchioles. Okay, let's see. Forgive the writing, I'm using my mouse pad. Okay, so pharynx, one more time, a brief overview. When oxygen enters the, let's put oxygen as a different color. Okay, when oxygen enters through the nose, it arrives at this place called pharynx. So pharynx is where the mouth and the nose area is connected. See, this is the pharynx. After the pharynx, it goes to the larynx. And the larynx is very important because the larynx prevents food from entering here or water from entering. The larynx, it makes sure that nothing else goes in. Otherwise, you would choke. So only the air is supposed to go in, but nothing else, no food, no water. And then after that, the oxygen continues going down through the trachea. So the trachea is the windpipe. Okay. And then in the trachea here where the division occurs, this is what we call, these divided branches are what we call bronchus. Okay. Oops. Forgive that. So this was bronchus. Then we enter into the bronchioles. And then over here is the alveolus. Yeah. So the function of the trachea, the windpipe, the name says it, windpipe. It's a pipe for the wind to go in or go out. And then it goes into the this bronchus. Bronchus, there are two bronchus so that some air can go to the left lung and some can go to the right lung. So it's divided, okay? The workload is divided. And then The bronchus then further branches out into many small branches called bronchioles, and the bronchioles reach to the alveolus, and there are millions of alveolus, so you can imagine that you need a lot of branches there. So that is it. Elizabeth, is that good? Is the summary good enough? Do you get it this time? Okay, good. You're welcome. So I will discard the changes. Okay, let us continue. So now, as you all know, not everyone can breathe properly. There are different examples of lung conditions, but in your syllabus, we're focusing on asthma. So you can read more about asthma as well. Basically, asthma is one of those conditions in which patients, they have great difficulty breathing, especially when they get an asthma attack. Any of you here have heard of asthma before? If you have, raise your hand. Do you know, yeah, there's Cheyenne knows asthma and Kempar. You may know friends who, yes, Jack. Yeah, so you may have friends, or even you, who knows, maybe you also have asthma, like some of you may have it. You don't need to say it out, but asthma is becoming very common, especially in this day and age because of pollution. Like that's one of the factors that researchers are looking into. But asthma is that condition in which the patients have sudden difficulty of breathing, and their heartbeat becomes very fast and they become breathless. So it's like that. And then you hear a wheezing sound in their breath. So let's look at it one by one so that you all don't get confused. So it is a condition that causes minor to significant difficulties in breathing due to narrowing of the airways. So because your airways become narrow, the patients who suffer from asthma, their airways become narrow, become thin. So it's not easy for oxygen and carbon dioxide for lots of it to go in and come out. For oxygen to go in is hard because it's so narrow. And for carbon dioxide to come out is hard. Just imagine like you're driving on a narrow road. It's very difficult, right? It's very difficult for smooth flow if it's so narrow. Oxygen has to go in, carbon dioxide has to come out. So because of this narrowness, it can become very difficult. The same way for asthma patients, because of this narrow airways, it's very difficult for them to breathe properly. And when someone is having asthma, you can tell, like they have breathlessness, they have wheezing, you can hear a sound when they're breathing. And they may tell you that their heart is beating really fast and they feel tightness in their chest. And sometimes they cough, and other times they may also actually vomit and throw up. And they do feel drowsiness, they feel tired. When an asthma attack happens to a person, sometimes their lips can turn blue because of that lack of oxygen. They're not getting enough oxygen. So you see the lips turning blue. Again, the breathing, you will be able to hear their breathing. They're breathing very fast. And then their heart rate is fast. The pulse rate will be high. And then you can just tell from the look on their face that something is not okay because their respiratory system, like something is off with it. You can really tell when someone is having an asthma attack. So why do some people have asthma and others don't have? These are some of the factors that scientists and researchers believe contribute to asthma, like what can increase your chances of getting asthma. So one is genetics. Let me check the chat. So, okay, Elizabeth asked, so for those who have asthma means they have narrow airway from the first, or is it because of some condition? They have narrow air from the first. Okay, so it could be genetic. Thank you for asking that question, Elizabeth. We're going to that. So sometimes it's because of genetics. Like genetically, they have very narrow airways. So one could be that. Another reason could be you can get asthma later on in your life. You're not born with it, but you can get it later on because of pollution. Pollution, which like in the olden days, it wasn't that big of a problem, but pollution did increase with our generation, the previous generation. But after industrialization, when industrialization happened, pollution, air pollution did increase. So more people started having asthma. It could also be because of allergic conditions. Some people, when they uh, some people they can't handle springtime because of allergies, and sometimes those allergic conditions can also lead to asthma. For example, some people, they will not get near flowers, like they love flowers but they can't because of the pollen. That can also, so those allergies also constrict they constrict means to narrow it down, to tighten like this, so constrict the airways. And then another reason is also because of childhood exposure to tobacco smoke. So that's why they say it's not good to smoke cigarettes near children. Like, it's not good to smoke near children because it can actually affect their airways. So a child may not be born, like genetically, they may not be born with it, but because of that exposure to tobacco, it could lead to asthma. Okay, is that clear? If it's clear, we'll move on to the next slide. Okay, thank you. Next slide. Okay, so how is asthma diagnosed? Like, how do you know that it's asthma and not some other condition? Let me go back to my mouse. Let's see. Let's have a look at the picture first, okay? I want to show you here clearly. So you see this is the normal, this would be the normal airway. The trachea, the bronchus, bronchioles. Normal looks like this. But then with asthma patient, you see, it has tightened. Over here, you see it's very relaxed. There's lots of capacity and space. But over here, because it has tightened, the muscles here have tightened, then you see inflammation, swollen walls. There's a lot of extra mucus, which makes it very difficult for the person to breathe. Yeah. I put this picture for you all to later on refer to as well. This one is not the moving one, but I read from the side. But this is this breathing to the night. But when it becomes an you also breathe through your mouth. Just for this is the diagnosis. It measures the rate of your lungs. Okay, so it shows how fast you're breathing and how much. Oh, is it better now, Sue? So is my Wi-Fi okay now? Is the video still lagging? And let me see. Okay, my Wi-Fi seems okay. Okay, thanks, Sue. Okay, so how do doctors or researchers test for asthma? How do they see if a patient has asthma or not? They can use any of these. They can use the spirometry. They can use a peak flow test. They can use FANO test. So again, these are just for like your information, but it's okay if you forget the names. But spirometry is they measure your breathing rate, and they also see how much space your lung has. for the air. And peak flow test, in peak flow test, they measure how fast the patient is breathing out. And the FANO test, they measure the level of nitric oxide. That's one of the gases that can be found in the lungs. So they measure that and see based on that whether the person has asthma or not. And then how is it managed? So for management, you will see if you have friends who have asthma, you can ask them if they're comfortable with it. They usually carry inhalers. So the inhalers, it helps them breathe, maximize the air that breathing in. So doctors could, they give inhalers. They could also give tablets. Sometimes the cases can be quite severe. So in that case, they do give tablets. These are just some of the names. Injections, there have been times when you see a patient turning blue and unable to breathe, and then they will be rushed to the hospital. And in that case, then they give injections so that it works faster. It relaxes your muscles so that the airways can allow for more air to go in. And then, so asthma patients or even other conditions, lung conditions, for other lung conditions, there are therapies available. Like there are therapies, they teach you how to breathe properly. And there are some techniques that you can follow. The breathing exercise, they help you with that. So that is another way to manage your asthma. Okay. I think someone joined the class. Let me just see who just joined the class. Okay, never mind. And that's it for your respiratory system. So do you have any questions? It is a heavy lecture if you've never studied bio before, but if you give it some time, if you read through the slides and just familiarize, like say the names out loud, then it becomes a little easier to remember. And I've also attached like these resources and references for you all. So you can go and read through here, or you can also watch videos and just watch the animation and how it works. That was it for the respiratory system. I will be uploading, some of you did reach out to me regarding the notes. I will be uploading the notes again to your Google Classroom. So the previous ones have also been uploaded there. You can always go and refer back to them. And I also recommend, like, if you're someone who needs extra resources, you can read like IGCSE biology books or A-level biology books specific to this content. If you're someone who likes to go in more details. And which part did you miss? The asthma, is it? Okay, let me go back to the part. So, okay, some of them had poor connection. Yes, okay, the asthma part. Sure, let's go through it one more time. Let's go through all the slides. Nasal cavity, nose, mouth, oral cavity, pharynx, larynx, trachea, bronchi, bronchioles, alveoli, and the gases. This, by the way, this is a picture of alveoli as well. And you can see the blood, see the red blood cell, the red blood cells are all in here in this vessel bloodstream. There, the blue one is the one carrying the carbon dioxide. The red one is the one that carries oxygenated blood. Okay, asthma. So let's go through it one more time. Elizabeth and Sue, I'm not sure where you missed, so I will just do it from the start. Asthma is basically a lung condition in which your airways become narrow. And people who have asthma attack or who are experiencing asthma, they have breathlessness, they have difficulty breathing. And you can hear like a wheezing sound when they're breathing. their heartbeat is very fast, and sometimes they cough. They have like so much coughing going on. They also feel tired and drowsiness. And severe asthma attack, they can turn blue, like their lips turn blue and their heart rate goes very high. And their breathing rate will also be very high. So why is it that some people get asthma? So the exact cause of asthma, like what causes the asthma, the exact cause is not known, but scientists and researchers do believe that these are some of the factors that increase your chance of getting asthma. So one is genetics. So it could be genetic, like it is in your genes. The narrow airway comes from genes. So that one definitely is like a bit sad because there's nothing that can be done about it. And then the pollution, it could be pollution. So maybe you were not, like maybe a patient was not born with the narrow airways and it had nothing to do with their genetics, but because they've been exposed to a lot of pollution. So because of that, the airways can actually become narrow, and there's a lot of mucus, and the muscles are very constricted and tightened. So again, it makes it very difficult for asthma patients to breathe. And then it could also be because of allergic conditions and childhood exposure to tobacco smoke. So that's why it is recommended that you do not smoke near a child, because it can actually have a negative impact on their bodies, especially since they're so young, and early exposure can lead to a lot of problems later on. So how do doctors diagnose asthma? Like, how do they know if a patient has asthma? And how do asthma patients manage those asthma attacks or just asthma in general? Let's go to the next slide. So here, before we proceed on how it's diagnosed and managed, here you see this one is the normal airway, not affected. So unaffected airway, relaxed, smooth muscles. But then if you look here at this one, this is the airway of an an asthma patient. So the muscles are very tightened. And then you see inflammation, like the walls are swollen. Here you see it's very relaxed. Here it's swollen, it has inflamed. And then you see a lot of extra mucus. So all this, it makes it very hard for air to smoothly go in and come out. Okay, that was just a picture of it. So diagnosis. So doctors can use or researchers that can use these methods. Spirometry. In this method, they measure the breathing rate, air going in and out, and they also measure the capacity of the lung. How much air can your lungs take in and take out? So that's one. Peak flow test is they measure how fast the patient is breathing out. Okay, and then the nitric oxide test, the FANO test, they measure the level of this gas, nitric oxide, which can indicate lung inflammation. It can indicate how swollen the lung, if the lung is swollen or not. And then lastly, so if someone has asthma, what can they do? How do they manage that? So for treatment, unfortunately, there's no cure for asthma yet. There's no like proper cure which can end it forever. But there are some ways that can be used to manage that asthma. So one would be inhalers. If you have asthmatic friends, and I said if they're comfortable, you can talk to them about it. So they have inhalers which help them with the breathing. Especially during an asthma attack, they will take it out and breathe through it. In severe cases, there are tablets as well, because as you saw, the lips can turn blue. The patient can struggle if the asthma attack is severe. So in that case, doctors may give tablets. Or injections. In emergency cases, they will give injections to save the life of the patient. But again, the injections are only prescribed by specialists. Not anyone can just give injections to, not anyone can just like give access to the patient to those injections. It's only prescribed by specialists. And then lastly, there are also breathing exercise that can be taught to asthma patients so that those breathing exercise help them how to do proper breathing. So apparently I did. So I do have this friend who works in this field, and she said that sometimes they have to teach us how to breathe, like not just asthmatic patients, but other patients also who have lung conditions. So they teach you how to breathe properly so that you can take like a lot of oxygen in and relaxing those lungs. So those exercises are also quite interesting. You can have a look at it. You can search more. Yeah, that's it. Elizabeth and Sue and Anne, is it clear now? Let me see, who was it? Elizabeth and Sue, yes. Is it clear? You're welcome, Sue. Okay, so lastly, don't forget to have a look at the resources, or you can just go online and find out more. There are books I would recommend that you have a look at IGCSE books and A-level books. No need to go so in depth, but you can just have a rough look at it and have like an idea of what it's like, and you can have more knowledge on the topics that I'm teaching. Yeah. And again, once you go back, try to look at the notes a few times, because that's what refreshes your memory so you don't forget the names. Okay. Are there any questions? You're welcome, and okay, so if there are no questions, that's okay, good. Please keep in mind that the next topic is on the cardiovascular system. So the cardiovascular system is related to the heart. So if you want to read beforehand, you can go ahead and read beforehand. But if you don't want to read beforehand, that's fine as well. If you have any questions, you can compile them first and then ask me in the next class. Okay. You're welcome, Elizabeth. Yeah. There was someone in the class who didn't join the last time. I received a message, but I forgot. Uh, they missed the first topic. Was it someone here? I'm not sure. Yes. Okay. So did you miss the first? I think you were there in the first lesson. Okay, okay. Yep, so next class is on Wednesday again, same time. So our classes are on Wednesdays and Fridays, the same time. Yeah, so just join back at the same time on Wednesdays and Fridays. Yeah, and let me take the attendance one more time. Wait, before you leave, just take the attendance one more time. Um, okay. Okay, you can, so if you have no questions, you can just leave the class now. And I will see you again on Wednesday, same time. You're welcome. Thank you, Sue. Thank you, Kimpar. Thanks, John. Goodbye, Elizabeth. You have a good weekend as well. Bye, Anne. See you. Cheyenne, if you have any questions, you can ask them now. Otherwise, you can just leave the meeting. Thank you. Bye bye, Anne.